go.
Plus a feline.
There's two more over there coming in.
Okay.
Let me finish what you're writing, sir.
There you go.
There you go. And here comes one more.
And now my friend Stephanie is going to go and do the audience as well. My name is Christy Williams, and I am doing a persuasive speech on women and heart attacks. And thank you everybody for coming. Okay. Tightness in the chest and back, funny feeling in the arms, shortness of breath, sweating, and vomiting, and numbness in the left arm. These are the symptoms that I had when I had my heart attack. I was 41. Knowing the symptoms of a heart attack and getting checked can save your life. Over 38,000 women under the age of 50 have heart attacks each year in the United States. According to Rachel Rabin Peachman at health.com and reported by ABC News. Also, cardiovascular disease, the leading killer of women in America, accounting for 1/3 of deaths. That's more than the combined death rates from breast, ovarian, and cervical cancer. This was reported by Share Care Incorporated in July 2009. When a heart attack strikes, it does not always feel the same in women as it does men. And women do not always have the same classical symptoms as men. Women may have all, none, many, or few of the typical heart attack symptoms. So let's not become a heart attack statistic and learn the warning signs and symptoms. Anybody can guess what the symptoms are of heart attacks in women?
And vomiting.
Yep. Anybody else?
Heartburn.
That is one. Symptoms of a heart attack: chest pain or discomfort. You may feel in the center of your chest, feeling like it is squeezing, and it may last a few minutes and it may come and go. You've got upper body pain that is either in the neck, jaw, shoulders, or upper back. You got stomach pain, and that can be, you can maybe feel no discomfort when that happens. You got anxiety, and that may feel like you're having a panic attack and you don't know why you're having one. You got shortness of breath. You may feel like it's heartburn or indigestion. You've got lightheadedness. You've got sweating, so you may feel like you have clammy skin and cold. Nausea and vomiting. Unusual or unexplained fatigue. And sleep disruptiveness. And when you have the unexplained fatigue, if you notice any prolonged or unusual disturbances, just make sure you're aware of them. Because the warning signs may occur, the warning signs may come 1 month or even in a short period of time before a heart attack will happen. Researchers show that women tend to ignore these symptoms because they think they are something else, like indigestion. That's what I thought it was. So what can we do to protect your heart and reduce the risk of a heart attack? There's plenty. Now let's look at some of these preventive measures and how they will help. Anybody know what some of the preventive measures may be?
Exercise.
Yes.
Diet.
Okay.
Healthy
Diet.
diet.
Anybody else?
Probably no smoking.
Yeah.
Smoking.
Doctor checkups.
That's what I saw.
Well, you bothered her.
Here are some of the preventions. You've got control your cholesterol, check your blood pressure, stop smoking. She used to.
She stopped?
I stopped.
Eat a healthy diet, and that's like fruit, vegetables, whole grain, low-fat dairy, and unsaturated fats. Reduce stress levels at work and at home. Reduce alcohol intake, usually 1 glass per day.
She looks at me.
So that one cancel out the other.
30 minutes of exercise daily. 6 hours of sleep a night. Know your family medical history. And don't ignore how you feel. Now, if you have a healthy diet, you will get the intake of calcium, potassium, and magnesium that you need. These are some of the most effective ways to prevent heart attacks in women, according to Marilyn Ellis and Edward C. Geeks, MD of LifeScript Health Center. By doing these steps can greatly reduce your chance of a heart attack. Thank you. I know some of these preventions are easier said than done, especially the way life is nowadays. But even with some sort of effort, you can help prevent a heart attack. So these are some of the preventive measures that you can take on your own, but there's also some tests that you can take to see or reduce the risk for a heart attack. Now, let me tell you why you should get one of these tests done. Anybody know any of the tests?
I didn't until I wrote them.
Okay.
I didn't. Some of them I didn't have a clue about.
That can be
And they didn't even say one on there, did it?
not
Stress
a,
test.
not a stress test, no.
Look at that lovely handwriting.
That's why I lay on this way.
I told her to write it.
There you go.
All right. Says we have the coronary calcium scan. Now, this was reported on by David S. Martin on CNN, and he had several of these imaging tests that he did talk about. Now, the coronary calcium scan was invented by Dr. Arthur Augustine, a Miami choreologist and author of the South Beach Diet books. This scan looks at plaque in the arteries leading to the heart. Now, ultrasound of the carotid is another one that Dr. Augustine suggests that you should have, and that looks at a the plaque in the main blood vessels leading to the brain. Both of these tests are invasive and outpatient. Also, most hospitals now offer these tests, some less than $100 for both, and they are covered by most insurance. Now, another test that Dr. Augustine suggests is a $65 blood test that looks for bad cholesterol or the LDL. When a patient has a lot of small LDL particles, they are more likely to have plaque in the blood vessels. Now, these tests give patients a chance to change their diets and their lifestyles. Now, in closing, do not play Russian roulette with your life, especially women. Think about the signs and symptoms and be aware of the preventions. Get checked. It could be the difference between life or death. Thank you, everybody.
Yay.
That was informative.
Do you want me to record the critique section as well? Okay.
Please.
No problem.
Mom? Oh, let y'all fill it
No,
out.
okay, we fill this out first.
I mean, you can talk about it.
Okay. Do I have to stand up?
Yes, you do.
Okay. On the introduction, she gained attention and interest, introduced the topic clearly, related topic to the audience, established credibility, and gave a view of the main points. And you rate how she did on that one. Body was organized and easy to follow, used sufficient support, used interesting examples and details, used effective transitions, and audience gained new info. The conclusion: prepared audience for ending, summarized key points, and used a memorable closing. Citing sources, gave 5 references to reached info. Involving the audience, asked questions during speech. Delivery, appeared confident. Used the conversational delivery style. Used appropriate volume. Maintained strong eye contact. Avoided filters like like, and so on. Used appropriate vocabulary. Used extensive body language. Okay, moved, didn't stay in one place. Had a good posture. Dressed appropriately. Handled presentation aids effectively. And overall was enthusiastic about the topic. Adapted the speech to the audience. Was well prepared. And completed speech within time. Okay, is there any feedback for Christy?
Well, after having been involved in both of them, I thought you did a lot better. You asked questions and you had your props, and I think that was great.
I do too.
Yeah.
Just a couple points to still work on is the audience involved, discussion.
Well, we weren't very good involved, honey. I thought you did a really good job on citing your sources and making eye contact. And you also projected very well, and you stayed on task and really made it enjoyable.
Thank you very much.
Yes, yeah, I agree with Stephanie. It was much better than the first one. You were very nervous on the first one.
Yeah.
Still very nervous.
Yeah.
But you did
Plus
fine.
it is warm in
You did
here.
much better.
Any questions or anything from anybody?
I don't think so.
And I actually learned a lot.
Yeah.
So what were your symptoms of your heart attack?
Mine was I had the tightness in the chest and back. My arms felt funny. I was sweating, clammy. I threw up. I couldn't sleep. And I just finally told Mom that I'd take me to the emergency room.
That's when
And
we left.
On the way, I noticed my left arm before we left started getting numb, and then I thought, well, once I get there, they may just look at me and say, oh, it's just indigestion or a panic attack and or food poisoning or something, but it wasn't.
The ER doctor told her that she was in the process of having a heart attack after they got her hooked up.
And the main artery was 100% blocked.
And up until that point, she had not had any symptoms or...
Well, I just
Nothing
thought it
ordinary.
was normal everyday life. I mean, yeah, I was tired a lot,
Tired a little
but,
bit.
had indigestion a lot. But didn't even think about that.
Right.
So as I said, you think it's something else.
So we're a lot wiser after that one.
God didn't make it obvious for us men in the chest pain
Yeah.
and
Men do get more obvious
Yeah.
symptoms, and they usually get checked a lot sooner than women would.
and we
I
don't
found
get-
that out.
We don't get solo hints anyway.
Yeah.
Some of my co-workers said that their husbands just thought it was like a headache, their back of their neck hurt or something, and they had a heart attack.
Very good job.
Thank you very much, Miss Christine.